Welcome to Breakthrough Non-Hype, No-Nonsense Health Podcast. I'm Dr. Chris Ho, a skin cancer physician from Brisbane, Australia. In this channel, I discuss health and medical topics in a no-nonsense, non-hype manner. I admit that my thumbnails that brought you here might be a little over the top. I have to compete with many other videos with thumbnails that are very catchy, dramatic, even hysterical at times. Today's topic is a deeply personal and real to each one of us, has affected us and will continue to affect us, a topic that we shun even, but have to acknowledge how we think about and approach death. Why we need to rethink death, embracing the natural end of life. This podcast is inspired by an article in the December 2024 issue of the British Medical Journal by Dr. Anita Hennick, an expert in the study of death and how people in different cultures deal with the end of life. The article explores how modern medicine has shaped our attitudes towards dying. I found her insights really thought-provoking, and I'd like to share and explore some of the issues with you in a way that resonates with all of us. For much of human history, death was seen as a natural part of life. It happened at home, often surrounded by family. But over the past couple of centuries, things have changed. Death has moved from the home to hospitals, and with it, medicine has taken control. Now we tend to see death as something that can be fixed rather than something to prepare for as part of the natural cycle of life. This shift has certainly had its benefits. Modern medicine has relieved pain, saved lives, and helped people living longer, healthier lives. This shift has certainly had its benefits. Modern medicine has relieved pain, saved lives, and helped people live longer, healthier lives. But over time, it has also created some unrealistic expectations. Many people now assume that medicine can solve every problem, even aging and death. But aging and dying aren't illnesses to be cured. They are just part of being human. As children of elderly parents, it's natural to want our loved ones to live as long as possible. This desire to hold on is understandable, but it can sometimes lead to pressure to pursue treatments that may not actually improve the quality of life in the long term. Families may not realize that choosing to forego aggressive treatments can sometimes be the kindest thing they can do, allowing someone to pass peacefully and with dignity. In Australia, while most people say they'd prefer to die at home, the reality is that many still pass away in hospitals. They can often be due to the fear, lack of preparation, and simply not knowing that there are other options. General practitioners or GPs can play a crucial role in guiding families through these difficult conversations and helping them navigate end-of-life care options such as palliative care. Hospices and palliative care offer a compassionate, supportive alternative to focusing on extending life at all costs. These services aim to provide comfort and dignity, helping people and their families prepare for the natural end of life. However, they're still not as widely understood or utilized as they could be. One reason for this is that society tends to view death as a failure, a problem to be fought rather than a natural transition. This mindset can make it harder for families to accept the dying process and recognize when it's time to focus on comfort, not cure. But doctors and healthcare providers can help shift this perspective. They can explain that while medicine is incredibly powerful, it can't cure everything. Choosing to stop treatment when it's no longer beneficial isn't a failure. It's a recognition of what it means to live fully with dignity until the end. Ultimately, we all need to become more comfortable talking about death. It's not an easy topic, but having these conversations can bring peace and clarity. When we realize that death is part of life and that patients have the right to choose how they want to face it, we can improve how we care for people at the end of their lives. Let's focus less on trying to fight death and more on living fully right up to the end. Key takeaways: death is a natural part of life, not a failure. Hospice and palliative care focus on dignity, comfort, and preparing for the end of life. Families and patients should feel empowered to make decisions that align with the patient's wishes. General practitioners, doctors, can help guide families with compassion and care. Medicine can't cure aging or death, and that's okay. It's part of being human. This is a difficult topic to discuss, but it's an important one. Let us bring compassion and humanity back into the way we approach dying.